and I'm the chair of the meeting.
Councillor Sue Bonser, Abbey Ward Councillor and Vice Chair of the committee.
Councillor Gulfraz Nice, Councillor for Albury Ward.
Seconded by me, Councillor Davies Ward.
Mel Ashmore, Strategic HR Manager, to present the attendance report.
Ismail, Head of HR and MD, supporting colleagues on reports today. Tanya Hay, the Organisational Development Manager, presenting the apprenticeship paper today.
Dominic Monaghan, Democratic Services.
Thank you. Okay, do we have any apologies?
We have apologies for Councillor Smale and Councillor Holmes.
Thank you. We're going to one for Councillor Khan.
Not heard any, doesn't it?
No.
Well, he may attend later. Item 2, later item will be introduced by the chair. To my knowledge, to this moment in time, there's none, unless there's something else I want to.
No later items.
Okay, item 3, declarations of interest. I invite members here if they've got any interest. No, none. Okay, item 4, the minutes of the meeting held on the 11th of January 2024. And for the record, before confirm those minutes, I'd like to convey my appreciation and thanks to Councillor Bonser, the Vice Chair, for chairing the meeting with my unavoidable absence on the 11th of January. Thank you. Okay, let's go to the minutes. Page 1. Page 2. Page 3. That's the end of the minutes. Does anybody have any comments about the minutes?
No.
And we can take them as a true record.
Yep.
Thank you. All right, item 5 already. Colleague health and wellbeing update on Q3 attendance management performance. And I believe this is Adele.
Thank you, Chair. So the Q3 attendance management performance report is one that I'm doing on a standard report on a monthly basis. So it's for the committee to note the recommendation for the colleague and health and wellbeing offer that is available for council colleagues, and for the committee to note the council attendance performance for Q3 of 3.33 FTE days lost against a year-end forecast of 11.77 FTE days lost for 2023-24. The year-end target is 10.5 FTE days lost. So in terms of the supporting information that we've got, we'll continue to keep the focus on the health and wellbeing of our colleagues during 23-24. And at 4.2, we go on to our occupational health and wellbeing approach. The council provides an in-house doctor-led occupational health service, and we have achieved our annual SLA of 15 days from referral to consultation. So the occupational health service is on track and delivering appointments within 5 to 10 days receipt of the referral. So an integral part of the wellbeing offer is the employee assistance programme, and that is a 24 hours a day, 7 days a week service for all colleagues. We've had a total of 14 new counselling cases which were opened in January and a further 8 in February. To note that these are within People Services Directorate, remaining the highest user of the counselling service, and all of those sessions during that January and February period. So the top 3 reasons for assessing those counselling services across all council directorates were stress, anxiety, women's health and family reasons, and personal issues, which accounted for 72% of access, and work-related issues accounted for 28% of access. So in terms of then the impact for attendance for the Q3 period, the council's performance for the Q3 was a result of 3.33 FTE days lost, which is an increase on the last quarter, with a year-to-date result of 8.83 days FTE days lost. So the Q3 result gives us a potential year-end forecast of 11.77 FTE days lost. Whilst that's above our target of 10.5, that will be an improvement on the previous year's end of year result of 13.34 days lost. So it is a slightly improved picture when we look at that compared to last year's. So in terms of the Q3, you'll see that from May to December 2023, we've got chief executives with 6.23 days lost, with a year-end forecast of 8.57. And we've got people services with 8.56 days lost and a year-end forecast of 11.77, and place with 8.72 days lost and a year-end forecast of 11.99. We continue as a HR service to focus our with heads of service on looking at these the data and the figures, looking at the absence reasons, the full breakdown, the turnover, to do any targeted work that we need to as part of addressing any service areas which are falling above their target. So the future focus for 2024 remains as us launching our wellbeing strategy, as that's one of our key work streams for the people and culture board work that we're carrying out. We want to wellbeing to be embedded in everything we do and championed at all levels and across all functions. And over the next few months, we'll be developing and launching our wellbeing champion network, signpost colleagues on a range of health and wellbeing issues. And our aim is to have 10% of the workforce on as wellbeing champion advocates. We're going to be launching our new internal wellbeing pages to support all colleagues so that they've got the tools to help them make the healthy choices whilst at work and to continue improving their own health and wellbeing. We'll be developing a wellbeing activity calendar and have lots of associated tasks and things that people can log on to take forward, and continue with the attendance group work and ensure managers are making progress against the targets. So in essence, we're asking the committee today to note our wellbeing offer for all colleagues at 2.1, and at 2.2 to note the recommendation and information of the Q3 target information for this report. That's it. Thank you. Any questions?
And fellow councillors, any questions? Councillor Boxer.
Yes, at 4.4, you talk about the meetings and the sharing attendance information with the directors and heads of service. Is there any targeted work that is suggested for the different directorates? We have talked about this before in terms of the higher than expected lost days in place and in people services particularly, and what have we identified as a result of those conversations? I mean, linking the people services figures with the instance of self-referral for stress and what have you. I mean, is it the case that the absence in people services is largely down to stress, and is that work related? And is the absence in place down to MSK, as we've talked about before? So what targeted work is happening within those departments to tackle those things? And is my understanding of the reasons for absence sound?
Well, I'd have to give you a further update on specifically the reasons for absence, because it's a wide range of number of departments, etc., which we can provide outside of the meeting. But what I can assure you with is the fact that each service area that is over target has an individual action plan, which addresses everything from the point of our return to work's being carried out effectively, and if they're not, and then we have some bite-sized return to work training programs. Are people being put into the informal process when they should be, and are managers confident in that informal process? Again, the same for the formal process. Are people being referred to occupational health at the correct point? So we do that for each of the service areas, looking at the reasons for absence. If it's work-related absence, I would be expecting the manager with the HRA to jump on that straight away, and we'll pick that up on a case-by-case basis. But we do have some very unique targeted work done in each of those service areas, depending on what we find.
I think what I'm concerned about is whether there's anything happening at work or anything in the environment at work that we could do something about, to improve, not only in terms of taking them through processes, but more in terms of, how are we reducing risk for people having to be off for those reasons? Yeah.
So we do that actively with the managers and the heads of service, and for example, if there is a grievance raised around the work environment, then we would target that as quickly as we can in terms of resolving any workplace relationship issues that may then cause some stress related absence due to non-attendance.
Yeah, I think that I'm not really getting it at that side of things. It's more in terms of, for example, in place, if it is MSK that's the main reason for people being off, is this because there's too few people trying to do jobs too quickly? You know, is there something happening that in the work environment that's contributing to to those sorts of issues? In People's, for example, if it's mainly work-related stress, then is that down to a workload?
Perhaps if I can share and to Councillor Bonson's question, just to supplement what Adele's saying, absolutely understand where you're coming from, Councillor Bonson. I think, as Adele said, some of the sort of more headline information about what are the top 3 reasons
Yes.
and place, we can obviously share with the committee outside to today's meeting. But I think just to try and confirm Adele's assurance that those targeted plans that are discussed in the services, as you were outlining, Adele, very much focused, because we're a very diverse organisation in the sense of different services and the number of
parents, men, and
absolutely. So although we have
social care,
although we have a consistent attendance policy and a consistent wellbeing offer, and obviously the policy has been approved previously by a personnel committee, it is about how do we then work with services and how managers manage as accountable officers for attendance at the council, how they apply their approach relative, as you say, to the specific circumstances, and as you were saying, Adele. So hopefully we can give the committee some assurance that our heads of service and managers take their people management accountabilities very seriously, everything from the support from the HR advisors, the wellbeing offer and occupational health support, external support that's available, how we signpost colleagues to that as well, because obviously, again, there are a diverse range of reasons. And as you can see from the counselling information, whilst we never have any details about the counselling in detail, because it's confidential, as you can see from the headlines, 72% of access for counselling is in relation to non-work issues, it's personal issues of people's lives. But we don't just push that to one side and say, well, it's not in relation to work, so we're not providing support. We very much are. So I think hopefully I can assure you, Councillor Bonser, as Adele has done, that our colleagues in services take their accountabilities really seriously, and they bespoke the approach to the circumstances.
That's what
we're saying. And I think we have I would say a strong focus on that in the council.
Thank you.
Yeah, thank you, Elizabeth. Yeah, I agree with Councillor Bonser. He's trying to tease out those tiny details without being specific and which one's or earmarking somebody. At the same time, you can fine tune from that to improve. So I totally agree with that. Do any other councillors have questions?
Yes.
Councillor Mint.
Yes, thank you. Thank you for the report. Just want to talk about 4.5, the future focus. You talk about wellbeing champion network. Your aim is to have 10% of the workforce as wellbeing champions. Why is it talk at 10% and not more?
Certainly, I'm very happy to pick that up. Thanks, Councillor Armin. Just to set a little bit of context, if I may. So we already have a strong mental health champion network where we have trained, a number of us are in the council, mental health champions who can provide support and advice on mental health issues to colleagues. But what we're looking to do is to continue having mental health champions, but wellbeing champions or advocates as well. And our starting point is to have 10% of the workforce, because obviously this is a role that colleagues, whether a mental health champion or a wellbeing champion, and they are two distinct roles. This is as well as the day job, if I can put it in those terms, that colleagues have, but we have a range of colleagues already as mental health champions across our diverse services. So what we want to start off with, 10% feels a reasonable number to at least start to help support the continued rollout of our wellbeing offer. And obviously that's something that we'll keep under review once we've launched it, to see is it having the impact? Is it having the reach that we would hope? But we want to, I think our aim is to have a reasonable number who have an appropriate impact, rather than trying to have too many initially and people feeling, well, I'm spread a bit too thin because of, want to give our best in those roles. So it's something we'll keep under review, Councillor Armin, but our aim is initially at least to start and have a purposeful 10%.
Right. Thank you, Liz. I've got a couple of minor questions, I suppose. These FTE days, full-time equivalent days, it'd be interesting, not today, but possibly in the future, to see them expressed in actual physical number of days for each department. So say that department, it's the full-time equivalent, so we've lost like 600 days or so we can see it not just as an equivalent. Then we know the impact. We think, wow, we've lost 600 working days or whatever. That'd be quite interesting. And then the second thing is, Sue and I did speak briefly about this, is when we get these lost days, what's the agency staff and supplementary? How do we mop up where we're catching up, where people have got behind on the work and things like that? Yeah, I know you'll have answers.
Thanks, Chair. And
I'm sorry.
so we do have a number of agency workers who will work for the council, sometimes when colleagues are absent due to ill health. And again, we report on that through our corporate joint committee on a quarterly basis, so with our trade union colleagues.
Yeah.
I think, again, if I can come back to that comment I made earlier about a very sort of diverse organisation, as I'm sure the committee will appreciate, there are some roles where if we have sickness absence, we need to have cover.
A dust cart, for instance, a refuge.
Refuse, our care roles, etc., where we
It's essential. Yeah.
not have cover. There will be other roles in the council where a decision is made, particularly if there's a short-term absence, that is managed and the colleague is supported with their absence, but we don't bring in temporary agents because it's a short-term absence and it's in a type of role where, at least in the short term, that can be absorbed within the existing policies. So I guess I would say, Chair, as you would expect, it's a mixed picture, again, depending on the circumstance, the type of service that we are providing for residents in the city.
Okay, because I think going forward, if we knew the actual days lost for each of these major departments, and then also the cost for the getting contract agency staff into things as well, it'd be interesting to see that, wouldn't it?
Yeah.
Be built at night. It's digging a bit deeper, and I know you've got information. Thank you. Any other comments?
A quick comment. It might not be the right question.
Let's cancel the last.
When, like we just said about the bin lorries driving from, do you have a replacement for them? Say if they phone up in the morning and say we're not coming, or like last couple of weeks, there's been a lot of them being off. How do you cover that?
So the service councillor hours deal with that. They manage that. They have agency workers that they might call upon. They might use existing workforce depending on where the area of absence is. So the heads of service and their managers down at the depot manage that very proactively and have done for many years on an ongoing basis. So they manage their staffing based on who they have already in the service, who might be able to help cover, and also they will call upon, as needed, as appropriate, agency workers.
Because if you get staff missing inside an office, you don't get noticed. Nobody will notice it.
You would on the bins.
On the bins outside, on the ground. But even the public are asking, why is my bin empty? And
We have regular campaigns down in Street Pride area for example, so we do have training programs where we'll train people up that are collectors to also be drivers. So we always have that backup within the service for covering that driving route and for succession planning through.
As well as being able to call upon if we need to agency workers as appropriate. So, and the service, as I say, are very experienced, I should say, in managing that scenario because of the nature of those roles needing, the impact in the city.
I agree with Councillor Noaz, and you nearly want, and I think my fellow councillors will agree with this, is is you will nearly want a few more staff on the books permanently. So you're slightly overstaffed, but you can have them doing other tasks, but then you can pull them in as and when's needed because one of the drivers is off, you know, or something like that. So instead of having to go onto the expensive agencies and things, you've got more resilience built in. You know, that ethos, I think, is a good way forward. Yeah. Anyway, it's just a comment. Any other councillors? No. Okay, we'll move on to item 6, the apprenticeship programme. Tanya, I believe this is your department.
Thank you.
Thank you.
Again, this is a standard report that comes to the Personnel Committee on a quarterly basis, and the focus of today's report is to provide information on some recent successes within the programme, also to give information on the government's announcement and the increase of investment for the apprenticeships, and also to give the usual breakdown of the financial picture of our levy spend. So I will move on to our supporting information. And to start with, as you can see, I have brought an award with me. I thought I would bring it today to show you that this is an award we were given for its Employer of the Year from Buxton and Leek College for the support that we have been giving to our level 3 team leader manager apprentices. So we were awarded that during National Apprenticeship Week.
Yes.
So we were very pleased, and as you say, I'm quite proud. So I thought I would show you the award this morning.
Very pleased.
So yes,
Very nice.
it's very welcome, very welcome. So yes, as I mentioned, this was part of the National Apprenticeship Week, which was run in February 5th to the 11th. We had a busy week. So we went up to Buxton and Leek College, received the award. We also joined an event with the University of Derby at Kelliston Road, supporting with school leavers to raise awareness of the opportunities that are out there, along with other employers. And we also went to the Derby College group event as well, again similar, to raise awareness and support with the apprenticeship initiative across the city.
Yeah.
So very well attended, all events, and we had a lot of expressions of interest at our stand. So it was very worthwhile going and very pleasing to see. So we've also been nominated for Apprentice of the Year award with Nottingham Trent University for one of our social workers, one of the apprentices there. And this is the second time we have been nominated. And the first time we were nominated, we were lucky enough to win the award. So we've got fingers crossed again that we hopefully will be successful this time. And that's in the health, education and care sector of the university. And we've also got 2 of our colleagues nominated as mentors of the year, apprentice mentors of the year, for the mentor programme that's within the workforce development teams in adults and children's. So we've technically got 3 people up for awards in May there. So as I say, fingers crossed. Mm-hmm. Also, hot off the press of yesterday, that's why it's not in the report, we have 2 finance apprentices that have been nominated for Female Apprentice of the Year by the East Midlands Chamber for Enterprising Women Awards. So really pleased to see that as well in our finance department. So as I say, the reason it's not in the report, we only heard that yesterday. So again, I thought I would bring that another success to the committee. So those are some of the successes we're having. Again, we have as the business as usual successes. We've got more people coming on programme. We've got as you well know, our very positive and successful leadership programme, where we are going out for communications again in the near future to for a September start there. So I hope I'm going to have a nice strong cohort there in September as well. So moving on to core point 2, we've got the government increase in investment in apprenticeships. So this was announced on March the 18th at the SME Business Connect by the Prime Minister, who announced that there's going to be a further £60 million to boost apprenticeships. And this is with an aim to increase opportunities for young people and also equip business with the skills that they need to thrive. So the additional funding will help to meet the increased employer demand for apprenticeships and support the continuation of the quality provision of apprenticeships. So as part of that announcement, two of the measures that are in place, one is from the 1st of April, and this is more directed at small and medium enterprises. And this is where at the as of the 1st of April, they will no longer have to contribute to the cost of the apprenticeship training for 16 to 21-year-olds. They did have to contribute 5% of that cost with the government funding the 95%. Now they don't have to fund any of the costs for the 16 to 21-year-olds, which will support SMEs across England. And the one that's more pertaining to us is from the 6th of April, the levy pay can now transfer 50% of their levy to support businesses. So currently it was 25%. It's just gone up to 50%. So to give you a little bit of context around that as well, at the moment we are transferring to 13 organisations, businesses in the city, varying sizes, and we are working quite closely with the economic regeneration team to now we've had this announcement to increase that substantially. Yes. We've already had Derby Homes come to us for further funding. They are looking to recruit 8 apprentices again in September, and we're going to fully fund those for them. So really pleased to be able to continue with that partnership work, that really successful partnership work with them. So that's the area around the increases. And then the final point is the usual financial update. So as of the 26th of March, we had transferred just over 5 million into the levy account, and that was from April 2017 to 26th of March. We have drawn down 2.6 million for our internal training programme, and we've also transferred just over £250,000 to the 13 local organisations and businesses. Up from November 2019 to March 2024, we have had expiration of funds of just under 700,000 that the government that we have to give back to the government, that they then utilise in the wider training programme, the wider apprenticeship programme. But what I will say is that over the last 4 months, we haven't had any expiration of funds. We are utilising all of our funds, and we're hoping that the transfer will support that moving forward as well. So I've also given you a breakdown table there of our year-on-year paid cost into the levy and our year-on-year spend. So that gives you a breakdown of where we are to date. And that really concludes the paper. So if you've got any questions, I'll be pleased to answer them.
Thank you, Tanya. Any questions, Councillor? Councillor Bonson.
Yeah, I'd just like to congratulate you, Tanya, and your team on the employers. I'm sure we all want to join in that. And to pass on, if we can pass on as a committee chair, our congratulations to the apprentices that are up for awards as well. I think, that's really well deserved, and it's great that they're getting that recognition. So, yeah, well done to everybody on that. On the increase to 50% of the funds that can be transferred out to other organisations, do you think we'll be able to utilise that?
I'm hoping to be able to utilise that. Yes. They have we've supported them with a substantial amount there. I'm working very closely, as I say, with the economic region, and they are reaching out to organisations and businesses in the city I also work quite closely with about 20 training providers who provide our internal programs, and also reaching out to them to see if they have any employers that we can support. So I'm utilising all of the networks we can. I also am utilising the D2N2 Compact Group network that I co-chair. So utilising that network as well to see if we can support any employers there as well. So we are reaching out as far as we possibly can, attending as many events as we can to raise that awareness. So the aim is to increase. Yes.
That's fantastic, because I mean, obviously, I mean, I'm sure we're all agreed that you know, we'd like to use every penny of that money here in Derby, you know, for the benefit of workers in Derby and people in Derby. So yeah, brilliant. Thank you,
Councillor Lonson.
Councillors, any other comments?
Just
Councillor,
congratulations on your award. Do you have any figures on sort of BAME community on apprenticeship?
I do have some figures on the BAME community apprenticeships, and I can provide you with those. I can send those through to the committee. Yeah, I met with the Department for Education last week, and they provided us with our BAME figures. So yes, I can send those through to you.
So you get from the BAME community come on to apprenticeship?
We do have and I'm so sorry, I can't recall the percentage now, but we do have a good percentage of people from BAME community that come onto apprenticeships, yes. And also, just as a note as well, we are attending the Stephen Lawrence Day event on the 24th of April to support in the community there as well, to support with reaching out to the BAME community to raise awareness. So I am going to be attending that event as well. Yeah.
Oh, thank you. Yeah, I'd like to just really reiterate my colleagues, councillor colleagues, congratulations. It's quite significant achieving an award like that. It really is. And also good luck to the ones at Nottingham Trent University, including the female finance apprentices. We wish them well. We really do. Our fingers are crossed. And also just being nominated is quite a big achievement in its own right, really. And that shouldn't go unnoticed. So it is significant. It's good work. Congratulations to you all. Thank you.
Thank you, Chair.
Okay.
I believe that concludes the meeting.
Thank you.